we're going to go through this path, and you've probably seen this if you watched anything I've done. This path hasn't changed. This appears to be the sequence of events that leads to SIBO in IBS and IBS. That food poisoning on the left, the toxin CDTB, and the development of antivinculin antibodies causing a reduction in the nerves of the gut, specific nerves I'll show you, and then leading to stasis of the gut and bacterial overgrowth. And so we're going to talk about food poisoning first. So food poisoning causes IBS. There is no debate about this. There is some debate about whether we should call it IBS or post-infection IBS, but essentially you get a food poisoning at a wedding, and ever since then you've had a change in your bowel function, and they call that irritable bowel syndrome of the post-infectious type. But imagine, though, that 1 in 9 people who get food poisoning, or 11%, get IBS. And we actually modeled this, and food poisoning in the United States, based on how much food poisoning is out there, could account for about 2/3 of IBS. So we believe about 60% of IBS-D could be accounted for by food poisoning. Now, that 60% number is going to carry through this presentation because we keep seeing the 60%, 50 to 60% number over and over again in terms of how we see IBS.